Thanks very much, John. Very difficult to speak after such compelling speakers and from such a region that has made such incredible progress, really. Very, very impressive. Our regional director, Dr. Hans Kluge, could not be with us this morning, so I'm here in his place. I will be very short, as I promised John. Hep B and Hep C have the highest burden, or are the highest burden, of communicable diseases in the European region. 10.3 million people live with Hep B and 8.3 million with Hep C. Despite the fact that 9 of our member states have achieved Hep B control targets, mainly through childhood vaccination programs, 53,000 people a year die from Hep B, Hep C in our region every year, which is quite remarkable. And hepatitis really exposes gross inequities and inequalities across our 53 member states. 80% of the burden of Hep B is in 13 countries, 80% of the burden of Hep C in just 10 countries. If someone had told me 33 years ago when I started my career in communicable diseases in Afghanistan that we would be here in 2024 with treatment which should be available, but treatment costs Hep C down under $100 US, Hep B $2 per month, I would have told them they were being absolutely absurd if they were to tell me that 53,000 people were dying in the world's wealthiest region from hepatitis. The job is far, far from done. 39 national action plans in our region with great variations in terms of implementation. We've introduced 3 accelerators on hepatitis. The first is a 2022 regional action plan to end HIV and to eliminate viral hepatitis and STIs, which all 53 of our countries adopted at our regional committee in 2022. The second is that we've put hepatitis at the center point of the regional sub-regional blocks and action plans that we have. So we have a Central Asian roadmap. We also have a Western Balkans roadmap, which is endorsed at head of state level, where hepatitis has been placed at the center point. Another accelerator is the manifesto that we've just seen from our regional director, who is up for re-election at the end of October. Should he be successful in that re-election, he's put multiple disease elimination platforms at the center point of his new vision, his manifesto, and what we hope will be another 5-year vision in the European region under the European Programme of Work Mark II. The third accelerator is partnerships. We're working closer and closer through and with collaborating centers. RKI, we have CDC. I was just speaking to Rania a moment ago. We have CDC with us in Ukraine. Actually, as I speak right now, integrating training in conditions of war. We work very closely also with the Georgian National Center for Disease Control, and we'll hear a little bit more from Georgia in just a moment, where in Uzbekistan we're promoting decentralization of Hep C service delivery. There are some countries standing out. You're going to hear from one of them, Georgia. UK is another one, where we really feel they are likely to achieve the hepatitis elimination goals well in advance of 2030. So it is possible. We do feel that others can follow suit if we continue sharing the lessons learned from countries such as those. Very much achievable. So thanks very much for the opportunity to speak today, John, and thank you all for listening.